Hey everyone, and welcome to another healthcare news episode. Today we'll be covering everything from the month of April. Just like last news episode, I'll start with a few of my favorites from this month. We've got some really interesting pieces here. We'll talk thoroughly about a potential new vaccine to treat skin cancer, the bird flu, which is making headlines everywhere, MultiPlan, which is a secret middleman of health insurance companies, and we'll end the detailed section talking about the Arizona abortion ban and appeal. After that, just like last month, I'll run through the rest of all relevant healthcare news from this month so that you can have a full picture of what's going on. I'll keep those sections very concise, so make sure to check the timestamps below for any sections that you might be interested in. With that, sit back and enjoy today's episode. You are now listening to the Gustavo Franco podcast, where we challenge the norms and uncover the truths of our healthcare system. I'm your host, Gustavo Franco. So let's start off with a new vaccine for skin cancer, or melanoma. This is one that hasn't been getting as much news attention as I think it should have, and the prospects here are super interesting. For some background, skin cancer is the most common form of cancer, with 1 in 5 Americans getting skin cancer by the age 70. I'm studying abroad in Australia right now, and it's even more shocking here. In our first day of class, we had an orientation, and one of the first things that they said was to put sunscreen on because 2 in 3 Australians are diagnosed with skin cancer by age 70. And although skin cancer is rarely lethal, especially if caught early, it's still important to know how to manage it. And a big part in managing melanoma is actually preventing the disease from reoccurring again. So we have to figure out how to best prevent disease recurrence. This is exactly where this new vaccine comes in. There was an earlier version of this vaccine that didn't work so well, but many of its functions carried over to this new version of the vaccine. First, there was a vaccine against tumor-associated antigens, which are these substances produced in tumor cells that call for an immune response. So it was thought that we could just use a general formula to detect these antigens and then draw the immune response to kill those cells. But turns out the process has to be a lot more personalized than that. So in this new iteration of the vaccine, each dose is custom built for the patient. And they do that by sequencing the DNA of cancer cells when the tumor is removed from the patient. It's a very neat process, and they even use AI to help make the final version of this mRNA vaccine for each patient. So, with all that, the first patient has now received the vaccine in what marks the beginning of phase 3 trials, which, if successful, could be a major step in cancer prevention and will be the first widely available personalized mRNA vaccine for melanoma. Now let's switch our attention to bird flu. I remember seeing the first article on the outbreak of the bird flu literally on April 1st. And I thought to myself, this can't be that big of a deal. But, oh well, turns out I was wrong, and it did become quite a big deal. It's been everywhere in the news this month. So, what is bird flu? Bird flu, or avian influenza H5N1 in this case, is a type of influenza that usually affects birds, but can infect other animals too, and that's exactly what we're seeing here. The virus is passed on through bird saliva, mucus, or feces. When it comes to other species, the virus can actually be transmitted in many different ways. For example, what we're now seeing is that milk from cows infected with the bird flu have traces of the virus in it, at least if it's not pasteurized milk. But we're lucky because the virus very rarely infects us humans, and there isn't really any evidence that we can transmit the virus to each other. So going back to the overall landscape of the bird flu outbreak, It all started last year when the bird virus was spilling from bird populations into some wild mammals. But the thing is, we don't usually interact with these wild animals like seals, foxes, polar bears. So even most experts dismissed it as an insignificant problem. The issue, though, is a little different when we talk about animals that we consume, like cows and chicken. And that's exactly where the virus has rapidly spread this year. But we only really became aware of it this month. According to the latest CDC report at the end of April, almost 91 million poultry in 48 states have been affected, and 36 dairy herds in 9 states have been affected. So far, only one person has actually contracted the virus, and it was luckily a very mild case. Poultry farmers have received millions of dollars to mass slaughter infected chicken. Dairy cows are a different story because initial findings suggest that the H5N1 virus is actually killed when milk is pasteurized, which is the form of milk that we actually consume. The issue here isn't really the virus right now, but what it could become. Influenza viruses are known to mutate rapidly, and if you have them in close proximity to humans, like in cows and chicken, you give the virus a perfect laboratory testing center for mutations to happen. And if any of these mutations make the virus easily transmissible to humans and between humans, things could turn dirty pretty quickly. Out of around 900 people that have gotten the virus since 2003, about 60% of them have actually died from it, so it's no joke. We're at no danger of it right now, but it could very soon turn into a big problem, depending on some lucky mutations. On a different note, let's turn to the business side of health insurance and talk about a little-known data company called MultiPlan. I didn't know about this company before, but when I heard about it, it was a no-brainer that it existed and that it performed fairly well. So let's unpack how the company works and how it's impacting many people's lives, because it could be the reason you are getting lower reimbursement rates from your health insurance company. MultiPlan plays a middleman between many healthcare providers and health insurance companies. Say you go to a doctor that is outside of your health insurance network. At the end of your visit, the provider is going to file a claim and send that claim to your insurance company for payment. This claim includes services that were done during the visit. Well, what your health insurance company likely does is it sends this claim to MultiPlan, and MultiPlan, being a data company, compares it to other claims and procedures, and with their algorithm, they determine a recommended payment for that claim. They then send it back to the health insurance company, and if the health insurance company accepts the payment, then that's what they're actually going to cover for that claim. Say your doctor put in a claim for $1,000 and sent it to your insurance company. MultiPlan then comes in and says that the recommended payment for that claim is actually $500. So if the health insurer accepts that new suggested claim, then that is how much they're going to pay for the claim, and then you will be in charge to cover the rest of the claim, which is, in this case, $500 again. You can see how that can turn dirty pretty quickly and become a problem. So let's look here exactly how MultiPlan makes their money. They partner with these health insurance companies, and because they help the insurers save money by suggesting that they pay less for a service, MultiPlan takes a cut of those savings. They call this model the, quotes, percentage of savings model. And the larger the savings for the health insurance company, the larger the fee that MultiPlan receives. MultiPlan likes to say that they're helping address the rising costs of healthcare, but I'll leave that up for you to decide. Now let's move on to abortion and talk about the Arizona abortion ban. The closer we get to the elections, the more we see in abortion, since it's just become such a political issue. And this month in Arizona, there was a complete ban on abortions. But then they repealed the ban. So let's look at how that happened. In a case between Planned Parenthood and Kristen Mays, the Attorney General of the state of Arizona, the court upheld an 1864 law that completely banned nearly all abortions. The 1864 law, which was in place before Arizona was even a state, said that all abortions after the point of conception are illegal, aside from when it's necessary to save the mother's life. Ever since the overturn of Roe v. Wade, Arizona banned all abortion procedures after week 15. But with a 4-2 majority, the court voted on April 9th to bring back a complete abortion ban as outlined by the 1864 law. The decision wasn't immediately put into effect, allowing for lower state courts to put in additional arguments. This also allowed for the decision to be overturned or appealed, which is exactly what ended up happening. But that took a long time, and the decision was mostly driven by political incentives and not genuine opinions about abortion. Right after the decision came out, Biden immediately condemned it as, quotes, cruel and, quotes, extreme. And he said pretty wisely that the 1864 law came, quotes, well before women had secured the right to vote. And Democrats have been unifying around this issue, especially led by efforts from Kamala Harris to villainize former President Trump for allowing all of this to happen. Social media was also going crazy after the decision, and protests were happening all over Arizona. So pretty quickly after the decision, actually the day after the decision, Democrats stepped in to repeal the ruling. But that didn't go so well, and the Republican majority shut them down. The pushback in the state and nation continued fiercely, and many Republican representatives felt persuaded to change their vote to ensure their seats in the future. So on Wednesday, April 24th, the House lawmakers repealed the ban with a 32-28 majority. The Republicans that made the switch are said to have done it almost entirely for political reasons to keep their seats. And on social media, they were condemned by anti-abortion activists and called, quotes, baby killers. Now, on May 1st, the case actually went to the Senate, which has a 16-14 Republican majority. And here, once again, the decision was repealed. So that is what happened in Arizona this month. And this brings us to the end of the 4 developments that I wanted to highlight in detail. Now, going on to the more fast-paced news on different areas of healthcare this month. Let's start with the topic of abortion, IVF, and maternal and child health, since we were just talking about that issue. Starting with IVF, the hospital that was at the center of the court case in Alabama said that they are completely ending their IVF services because of, quotes, a lack of clarity in recent legislature. In general abortion, the 2 lawsuits from Texas and Idaho discussing emergency medicine law for abortions in the Supreme Court highlights how justices seem split on emergency abortion access. In Florida, a 6-week abortion ban is planned to take place this week. The problem many cite with this restriction is that many women don't even know they are pregnant by week 6. Data also has become a big topic in abortion, with Republicans wanting more data on abortion, while Democrats want less data on abortion, fearing that it could be used to identify patients and make them reluctant to get the procedure. In child health, a recent analysis showed that more than 3/4 of infant deaths happened because of unsafe sleep practices, citing co-sleeping as a major source of these deaths. Co-sleeping is when infants sleep on the same bed as their parents. In Brooklyn, Woodhull Medical Center fired 72-year-old Dr. Ronald Daniel for his involvement in an infant's death and a mother's death only a few weeks apart. State health officials declared the hospital, which is already a weak medical institution in New York City, to be in, quotes, immediate jeopardy, end quotes, suggesting that the hospital poses potential dangers to patients. In surgery and medical procedures, an expert panel for the U.S. Preventative Services Task Force recommended that women should start regular breast cancer screenings or mammographies at age 40 and not what has usually been recommended, age 50. Following last month's news on pig kidney transplants, a 54-year-old woman received the second kidney transplant from a genetically edited pig at NYU Langone Health. The success of these transplants could lead to improved organ transplant access, which is especially vital now. A JAMA study found that Black and white patients have significant disparities in getting kidney transplants depending on whether they live in racially segregated neighborhoods and have racially segregated transplant centers. Still on organ transplants, Pennsylvania Hospital, Penn State Health Milton Hershey Medical Center became the second hospital this month to suspend its liver transplant program. They cited concerns in, quotes, clinical processes and documentation. This came after the Memorial Hermann Texas Medical Center in Houston suspended their liver and kidney transplant programs. They believe that one of their doctors, Stephen Bynon, manipulated his patients into not getting organ transplants, which could be life-saving. Authorities don't know his reasons behind it or if it's even confirmed that he did it, but it wouldn't be a surprise to me that he did it to improve record of successful organ transplants by only encouraging his healthy patients to actually go through the procedure because they're more likely to have a successful procedure. In other medical procedure news, Botox is on fire right now for what they call counterfeit Botox. These counterfeit doses and unlicensed providers have led multiple patients in the US to develop harmful reactions after injections. So watch out when you're getting your Botox and who's actually doing the procedure. In Michigan, vascular clinics owned by Dr. Jihad Mustafa are now shutting down. This came after scrutiny for his practice in leg surgeries, where he calls himself, quotes, the leg saver. Well, turns out multiple of the procedures that he was doing were funded by medical device companies and actually harmed patients, and many times ended up leading to leg amputations. In an interesting development this month, the HHS is demanding teaching hospitals to get written letters of consent before performing pelvic exams on patients. If these institutions don't comply, they could end up losing their Medicare funding. Now for mental health this month, a new JAMA psychiatric study looking at teens found that around 1 in 3 teenagers with depression who die by suicide or self-harm actually denied any thoughts related to that in a widely used mental health questionnaire only a few days or weeks before the incident. Understanding why these teens might be denying such thoughts is the next milestone here, but researchers think that it has to do with the fear of rehospitalization or that caregivers are going to overreact. In work mental health, a Bloomberg News article suggests that bringing your pet to work can actually help boost employees' mental health, so that might be something new and fun to consider. Now for kids' mental health, a new JAMA pediatric study came out to only strengthen a strong body of research that has existed for many years. It suggests that physical fitness is directly linked to improved mental health outcomes. This was seen specifically for depression, anxiety, and ADHD. So it's a no-brainer. Get your exercise in and make sure that your kids are doing the same. In mental health pharmacology, many doctors suggest understanding why one may have anxiety and treating the root cause of that instead of so quickly prescribing beta blockers to slow patients' heart rate and blood pressure to mimic calm. And that's what usually many mental health patients are now being prescribed. Now for viruses and bacteria, there's been quite a bit of news this month. Many of them are very interesting, and it really piqued my interest. Starting off, the World Health Organization finally came to consensus on a new, broader definition of an airborne disease. They came into scrutiny by many scientists during the early COVID years for not acknowledging that COVID could spread through air, because of their rather too strict definition of airborne disease. Previously, an airborne disease had to be one that traveled long distances in air and were in small particles. Now the new definition removes any droplet size requirements and any distance spread requirements. In HIV, there have been some pretty scary news this month. 3 women have contracted the virus after what's called, quotes, a vampire facial. These women underwent a procedure at an unlicensed facility in New Mexico, and it marks the first time ever that HIV is transmitted through cosmetic injection services. On a more positive note, there's new hope that a more sustainable form of HIV treatment will be available in the next 5 to 10 years. This could be a once-weekly pill or a once-monthly shot. Stay tuned for my episode with Dr. Sharon Lewin on HIV that's coming out in mid-March. In urinary tract infections, something that's becoming harder and harder to treat because of resistance to antibiotics, the FDA has approved a new antibiotic called pivmecillinum to treat these infections in women 18 and older. I hope I pronounced the medication right, but I think it's pivmecillinum. On hepatitis C, 15 countries are close to completely eliminating the disease this decade. The US, however, lags significantly behind, with most patients with the virus not even yet knowing that they have hepatitis C. The story also isn't pretty for TB or tuberculosis, which has been increasing every year in the US since 2020. Again, on a more positive note, a pill for Lyme disease, similar to what we give our dogs, is now finally in early clinical trials for humans. Moving on to Medicare Medicaid news, Mississippi reached a tentative deal to expand access to Medicaid in the state. This could give coverage to 200,000 more low-income adults. But to be honest, it's likely going to face a veto by Governor Tate Reeves. In more news about breast cancer screening or mammographies, which we talked about earlier, Medicare doesn't pay for additional screenings that some women might actually need. Some with denser breasts need MRI scans or ultrasounds, since regular mammographies might miss some tumors. A new analysis by the nonprofit institute RTI International and the Department of Health and Human Services, the HHS, found that mental health issues and substance use disorders often go untreated for Medicaid patients, even if they're eligible for treatment. Turning to general well-being news, there's always new and interesting stuff brewing here, so sit tight for this one. Starting off, apparently taking apple cider vinegar is a new trend. People are suggesting that it helps with blood sugar control, weight loss, acid reflux, and even skin health. Honestly, while it's hard to ignore all these positive outcomes that people are having, there isn't much research supporting any of these claims. So if you think it's working for you, well, keep at it, as long as you check with your doctor before, because it could be interacting with some drugs that you're taking or some of your metabolic functions. Now for another popular trend, quotes, Oat-Zampic, appears to be all over TikTok. People say that eating oats is helping them lose weight. But this is a bit misleading because oats are nothing like Ozempic, and they're also pretty caloric. They do have many benefits like having high fiber content, but they should definitely not be recommended so simply as, quotes, a weight loss drug. Staying on the topic of diet, some research suggests that eating your greens before your carbs can actually help slow digestion and the absorption of sugars, which can help keep your blood sugar levels in check. Although the evidence isn't extremely significant, it does seem pretty consistent, So this habit could have a small positive effect on your blood sugar level. A similar topic was discussed in a New York Times article that I really enjoyed reading this month. The article is titled, quotes, "Could eating less help you live longer?" I'm a big longevity geek, and honestly, I've been looking at research into this topic for a few years now. It's a hard road to travel because there's a ton of opposing evidence out there on the topic, and prominent scientists like Dr. David Sinclair have strong opinions on the issue, recommending both calorie restriction and time-restricted feeding. I remember after I read his book, I was pretty convinced that that was the right thing to do, but then you see a bunch of evidence on the other side of the spectrum, and it's hard to draw conclusions. So with that said, it's pretty easy to let yourself get carried away by one research paper, but there's also significant evidence on both sides of the pole. And I think that Dana Smith, the author of this New York Times piece, does a fantastic job in painting a holistic picture of eating habits and longevity. I strongly recommend that you read the article if you're interested in the topic. Still on nutrition, new guidelines by the Agriculture Department finally reduced the sugar and salt on the menu for school meals. Now let's talk about skin health. Most people care about their skin, and there was a pretty interesting article in the New York Times about it this month, saying that skincare is not just for your face, but for your entire body. The article said that people focus too much on their facial skin, but not on other parts of the body. And I have to be honest, I'm a victim of this myself. I don't know if I ever even used moisturizer aside from my face, but turns out that if you want to have good skin when you're older, you should be hydrating your entire body and putting on sunscreen every day. On physical touch, a new systematic review by scientists in Germany and the Netherlands found that people in general, in almost all stages of life, benefit from physical touch. It helps with mental health and even boosts people's mood. Another study in Bangladesh revealed that eyeglasses not only improve eyesight, but income too. Those with appropriate eyeglasses could get a better education and learn better, directly impacting their future and their careers. Now for an always exciting section, let's talk about drugs and alcohol. Beginning in 2026, all alcohol sold in Ireland is going to have to be labeled with, in all caps, quotes, "There is a direct link between alcohol and fatal cancers," end quotes. And also, quotes, "Drinking alcohol causes liver disease," end quotes. This is the culmination of a ton of scientific research from past decades. And I genuinely believe that it's a step in the right direction, making consumers more aware of the dangers of what they consume. On drugs, a body of public health experts are calling on the FDA to take back a controversial approval of a DNA test for predicting genetic risk of opioid addiction. They cited unreliable test results and the unintended consequences of false results as evidence for canceling this approval. Under scrutiny now, President Biden delays the ban of menthol cigarettes for what some believe to be a political move to keep the support from black voters, who are many times targeted by big tobacco. The Justice Department this month called for easing restrictions on marijuana. This could lead to a major change in federal policy, so stay posted on this topic. In a pretty funny and unsuspected move, religious lobbying groups in New York are pushing for legalizing psilocybin, or quotes, magic mushrooms, as they are cited to be key in some religious experiences. Now for climate change and the environment, the EPA, or Environmental Protection Agency, has been pretty active this month. First, they called for a complete removal of forever chemicals from tap water, where a new study found them to be pervasive in tap water worldwide. These chemicals belong to the chemical class PFAS and are linked to serious health problems, and their, quotes, forever and indestructible nature doesn't help there. The EPA also passed new regulations to severely limit pollution from coal-burning power plants. This new regulation could make these plants ineffective, and they might have to switch to new and different forms of energy altogether. They also passed new regulation to curb pollution from chemical plants, with the goal of reducing the incidence of cancer for those that live near the plants. More than 200 chemical plants are likely going to be affected by this. The US also passed legislation this month to limit toxic airborne silica from mining dust, which has been leading to increased cases of black lungs. This is going to give significant protection to many coal miners. Moving on to climate change, a CDC study found that heat-related ER visits rose in 2023. The severity, frequency, and duration of heat waves has increased in past years and is cited as one of the main reasons for this increase in ER visits. On a global perspective, health hazards linked to climate change are said to affect 2.4 billion workers. The report by the International Labour Organization says that 70% of the workforce are exposed to climate change health hazards. They said that we lose 18,970 lives and 2.09 million disability-adjusted life years annually as a result of 22.87 million occupational injuries linked to excessive heat. That was a lot of numbers right there. But climate change is impacting a ton of workers. Staying on the topic of global health, let's talk about dengue, because it's plaguing South America. There have already been 3.5 million cases in Latin America in the first 3 months of 2024. Compare that to the total 4.5 million cases in all of 2023, and you can see that this is a growing concern. In Brazil, a public research institute has proved that a shot can protect against the virus, but there aren't funds or production standards to roll out the shot quickly enough to stop the outbreak. Globally, cholera outbreaks have brought our stockpile of cholera vaccines to an end. We've completely run dry. 3 companies are now rushing to produce more vaccines to replenish the stockpile, but this issue will grow worse by the day as outbreaks become more and more common and the disease spreads. On a positive note, an easier-to-make version of the vaccine that is actually taken orally has been approved by the World Health Organization, which might be key in tackling these outbreaks. Still on vaccine, Merck ran into a production problem. Being able to provide only 2/3 of the HPV shots that they had promised in Africa. This will cause millions of girls to miss their HPV shots. In global gender news, England just became the 5th European country to restrict hormone treatments for teens in gender treatment. They believe that, quotes, a medical pathway will not be the best way to manage their gender-related distress. Scotland joined England as the 6th European country, with similar restrictions after England's report came out. In Gaza, heat waves have made it hard for most businesses to operate. Many of these businesses are pharmacies. They don't have the power to keep the medications in sustainable temperatures and cannot provide some of those medications at all. Moving on to the more business side of healthcare, Walmart is shutting down 51 of its health centers after having released plans that they were actually going to expand their centers. This is an immediate response to healthcare costs, which have made the clinics too costly to be profitable for Walmart. In pharmaceutical and drug stores, Novo Nordisk has become the most valuable company in all of Europe, with a market cap of over 57 billion, making it bigger than the entire Danish economy. A Chinese company, Wuxi Biologics, involved in the manufacturing of therapies for cancer, cystic fibrosis, HIV, and other illnesses in the US, is under scrutiny by Congress for potential national security breaches. Lawmakers say that they could be putting our genetic information and intellectual property in danger. For more positive news, we've made steps towards slowing the progression of Parkinson's disease, which has seen 4 decades of very slow developments. Now, a group of French scientists may have found that a GLP-1 agonist, the same category of drugs as Ozempic and Wegovy, can be the answer here. The phase 2 study showed that the drug could slow the progression of Parkinson's, but the evidence is not yet enough to be definitive. In other drugs, a drug called Relyvrio, which is a newly approved treatment for amyotrophic lateral sclerosis, or ALS, is now being taken off the market after phase 3 trials found it to be no better than a placebo. The valuation of their parent company, Amylyx Pharmaceuticals, plummeted right after this happened. Now, moving on to specifically weight loss drugs, supplement stores are trying to tap into the market, not by selling GLP-1 drugs, but by advertising products to help with, quotes, GLP-1 side effects. These marketed items can help with things like muscle loss, which comes as a side effect of the weight loss caused by the GLP-1 drugs. So they can market products such as protein powders and creatine to help with this. As these drugs become more and more popular, more and more people are going to complain about their price. Wegovy, which sits at $1,349 per month, is one of the most significant players here. Take it the whole year, and that costs over $16,000 per year. This month, Senator Bernie Sanders pressed Novo Nordisk to detail the pricing of the drug. At the same time, these GLP-1 drugs are continuously being found to help with other health issues. A report by Eli Lilly said that Zepbound reduced sleep apnea in patients taking the drug. Another report by Novo Nordisk said that its drug Wegovy helped with heart failure in patients with diabetes. It'll be interesting to see if these are direct results of the drug or simply the outcome of the weight loss that the drug causes, which, for example, in this case, weight loss alone helps with sleep apnea and helps with heart failure patients. Now, for medical devices, biotech, and AI, there has been some interesting news this month. Starting off with AI, clinics in the US are offering patients a new service. For an additional fee, mammograms for breast cancer will not only be read by radiologists, but also by AI models. Regular mammograms only detect 87% of breast cancer. Cases missed are usually in a younger woman or in women with denser breasts. Using the AI model can help radiologists do their work more efficiently and can also help detect breast cancer cases that would otherwise go by unnoticed. Now, we just got to figure out who actually pays for these services. Should the patient or the insurance company pay for the additional AI model reading? For more exciting news on AI, models are now being used for gene editing in the world of CRISPR-Cas9 technology. By analyzing enormous amounts of data, the model can create new sequences and versions of the gene editor. Still on AI, the World Health Organization developed a chatbot called Sarah to help with basic health education. You can speak to Sarah yourself on the WHO website, but beware because turns out Sarah has been getting many medical questions wrong. Now let's talk about Nico Health, a startup co-founded by the CEO of Spotify, Daniel Ek. Being, quotes, adamant to fix healthcare, Daniel's company is a full-body scan that can help detect the early onset of many conditions that would otherwise be missed at a general health checkup. The scan costs $230, which is actually less than I expected. I look forward to seeing how the company performs since there have been a few other whole-body scanning startups so far this year. medical professionals are still reluctant to recommend these scans since there isn't evidence that these technologies can actually improve health outcomes. But should we really always wait for evidence that might take many years and could hinder possible advancements in the future? I think we especially got to ask ourselves these questions when there aren't significant health concerns of such scan. Now back to the Philips CPAP device lawsuits that we've mentioned in previous healthcare news episodes. Well, Philips has now settled the lawsuits for $1.1 billion. The lawsuits had come from thousands of patients who said that the device had harmed them. Let's change gears now and talk about health insurance. Starting off with philanthropic efforts. A multi-million-dollar nonprofit group called RIP, or Rest in Peace Medical Debt, has helped Americans clear over $11 billion in medical debts. However, a sad new study found that paying off medical debts actually does not improve people's mental health or credit scores, which is pretty surprising. On Medicare Advantage programs, where the government pays health insurers to provide a specific plan for Medicare patients, a new decision is going to cut funding for the program in 2025 because of the high costs of the program so far for the government. This was a significant hit to many health insurers, which get much of their revenue from Medicare. Now for more data concerns, which we've been seeing a lot of in the past few months, Kaiser Permanente said that their patients' private health information may have been leaked to tech giants such as Alphabet, Microsoft, and X. Now let's finish off today's episode with some political healthcare news. In a Time interview, Trump repeatedly supported his earlier mention that abortion should be left up to states, and that he does not plan to take a national action on the issue, even if he has his own personal opinions on it. In his social media company, Trump also said this month in a video that he is not running to end Obamacare or the Affordable Care Act, but he's running to improve it. Or so he says, quotes, "We're going to make the ACA much better than it is right now, and much less expensive for you," end quotes. As for Biden, he's continued to condemn any state decisions against abortion. On a separate issue, President Biden and the Health and Human Services Department will expand the protections for gay and transgender patients, reversing a Trump-era policy that gave ground for federally funded health providers and insurers to discriminate based on sexual orientation and gender identity. Javier Becerra, the HHS secretary, said, quotes, "Today's rule is a giant step forward for this country toward a more equitable and inclusive healthcare system," end quotes. However, critics say that this might make doctors perform procedures that they're not actually comfortable with, and therefore it might not be in the best interest of patients. So with that, we've come to the end of April 2024 healthcare news. If any of the news that I mentioned today particularly interests you, feel free to shoot me a message on one of our social media platforms, and I would love to chat with you there. Once again, please leave your feedback so that we can work on making the show better. And don't forget to rate the show on our podcast listening platform. It's really important for us to keep pumping out quality content. I'll see you guys for another healthcare news episode next month. And for now, stay curious, stay informed, and most importantly, stay healthy. Thank you for tuning in to this episode of the Gustavo Franco podcast. We hope our exploration of the world of healthcare has been insightful and thought-provoking for you. The opinions expressed here are ours and of our guests, and should not be considered professional advice. This podcast is a collaborative learning experience for both the producers and listeners. While we strive to convey accurate and up-to-date information, we acknowledge that our research may have limitations. We encourage all of our listeners to supplement their knowledge by conducting their own research. If you enjoyed this episode and want to stay up to date on our future releases, make sure to subscribe or follow us on your preferred podcast platform and social media. We highly value your feedback, so please don't hesitate to reach out with your thoughts, questions, or suggestions for future topics. Together, we can foster a more educated America and contribute to a more effective healthcare future. Thank you for joining us on this healthcare exploration.